Welcome to our video on understanding autism spectrum disorder, ASD. In this video, we will provide an informative and objective overview of ASD and its impact on individuals and families. Autism spectrum disorder, ASD, is a neurodevelopmental condition that affects social interaction, communication, and behavior. It is a spectrum disorder, meaning that symptoms and severity can vary widely. Let's take a closer look at ASD. Individuals with ASD may engage in different activities, just like anyone else. However, they may experience challenges in socializing and communicating. Symptoms of ASD can include difficulties in social interaction and communication, as well as unusual and repetitive behaviors. These symptoms can vary in severity and may be present from early childhood. It's important to understand the impact of these symptoms on individuals with ASD. They may face challenges in forming relationships, understanding social cues, and adapting to changes in routines. While the exact causes of ASD are unknown, both genetic and environmental factors are believed to play a role. Certain genetic mutations and environmental factors may increase the risk of developing ASD. Research suggests that a combination of genetic predisposition and environmental influences during early development may contribute to the development of ASD. Diagnosing ASD involves observing a child's behavior, communication skills, and social interactions. A comprehensive evaluation by a specialist can help determine if a child has ASD. Early intervention is crucial for children with ASD. It allows for timely support and access to therapies that can help improve their development and overall functioning. While there is no cure for ASD, various treatments and therapies can help individuals with ASD lead fulfilling lives. Behavioral and communication therapies, educational interventions, and medications may be recommended based on individual needs. These interventions aim to enhance social skills, communication abilities, and adaptive behaviors, enabling individuals with ASD to reach their full potential. Coping with ASD can be challenging for individuals and families. It's important to seek support and resources. Support groups, educational programs, and community resources can provide valuable assistance. By accessing coping strategies and support systems, individuals and families affected by ASD can navigate the challenges and provide the best possible care for their loved ones. In conclusion, autism spectrum disorder, ASD, is a neurodevelopmental condition that affects social interaction, communication, and behavior. Seeking support and resources is essential for individuals and families dealing with ASD.
Autism spectrum disorder is a condition that affects how a person thinks, behaves, and communicates with others. It can include difficulties in social interaction and communication as well as unusual and repetitive behaviors. The term spectrum refers to the wide range of symptoms that people with autism experience. The disorder can have a wide range of symptoms and be severe. Autism spectrum disorder includes conditions that used to be considered separate: autism, Asperger's syndrome, and childhood disintegrative disorder. Some people still use the term Asperger's syndrome, which is generally a mild form of autism. Some people think that autism spectrum disorder is at the mild end of the spectrum. Autism spectrum disorder begins in early childhood and can cause problems functioning socially, such as in school and at work. A small number of children seem to develop normally at the beginning, but eventually they will show signs of autism. Autism symptoms sometimes occur between the ages of 18 and 24 months. Symptoms: autism spectrum disorder. In adults, there are three categories of symptoms which may be present in children with autism. These include behavioral, social, and speech or language symptoms. Symptoms are often described as the triad or the three areas on which professionals evaluate a child during an assessment. There can be one symptom in just one area, two symptoms in two separate areas, or all three areas may demonstrate behaviors that fall into the spectrum of autism spectrum disorder, ASD. Some children show signs of autism spectrum disorder, ASD, in early infancy, such as reduced eye contact, a lack of response to their name, or indifference to caregivers. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose interest in things they used to enjoy. Language skills typically develop at around 2 years old. Signs may be seen by this age. Each child with autism spectrum disorder will have a unique pattern of behavior and level of severity. Some children will have low functioning, while others will have high functioning. Some children with autism spectrum disorder have difficulty learning, while others have normal intelligence. Some children with autism spectrum disorder have signs of lower than normal intelligence, however, others have high intelligence. Adjusting to social situations can be difficult. There is no one-size-fits-all answer to how severe a child's symptoms are. It depends on the level of impairments and how they impact their ability to function. Some common signs that someone has autism spectrum disorder are social communication and interaction. A child or adult with autism spectrum disorder may have problems with social interaction and communication skills. Any of these signs: difficulty understanding facial expressions, not responding to others when called by their name, not initiating conversation, seeming uninterested in others. Some people may not respond to their name or appear not to be listening when you are speaking to them. This leaf seems to resist being hugged and cuddled, preferring to play alone in his or her own world. The person has poor eye contact and does not appear to be very happy. Some children don't speak or lose their ability to say words or sentences as they get older. It is hard to start a conversation or keep one going, and he will only start talking when making requests or labeling items. The person has an unusual voice, and it may sound robotic or like they are speaking in a sing-song manner. This passage is exactly the same as the one before it, but my second grader doesn't understand how to use the words or phrases. It does not appear that he understands simple questions or directions. She doesn't seem to be very emotional or feeling, and she appears not to care about other people's feelings. She does not show an interest in sharing things with others. If someone interacts with you in a way that you do not like, they might be passive-aggressive or disruptive. Some people have difficulty reading nonverbal cues, such as facial expressions, body positions, or tone of voice. Patterns of behavior. Many children or adults with autism spectrum disorder have repetitive patterns of behavior that are limited to a few specific interests or activities. Some of the signs that may indicate this include: the person is moving their body in a repetitive way, such as rocking, spinning, or hand flapping. This child may be engaging in activities that could lead to self-harm, such as biting or banging their head. People who have a ritualistic personality often become disturbed when their routine is disrupted. The child has problems coordinating movements or has unusual movement patterns, such as clumsiness or walking on their toes. They may also have stiff or exaggerated body language. My second grader is interested in the details of a toy car, but he doesn't understand its purpose or function. When to see a doctor. Autism spectrum disorder. Some babies develop at their own pace, and not all babies follow the same timeline as found in some parenting books. But most children with autism spectrum disorder usually show some signs of delayed development before age 2 years. If you have concerns about your child's development or think your child may have autism spectrum disorder, talk to your doctor. The symptoms associated with the disorder can also be linked with other developmental issues. Autism spectrum disorder often begins to be noticed in children during the early stages of development, when there are delays in language skills and social interactions. If your child has delays in cognitive language and social skills, your doctor may recommend developmental tests to determine if the child has a delay in these abilities. It is not normal for a baby to not smile or have a happy expression at 6 months old. A baby does not imitate sounds or facial expressions by 9 months old. Doesn't babble or coo by 12 months. At 14 months old, a baby does not typically gesture. This passage is not written in complete sentences by 16 months old. A child should not be playing pretend by the age of 18 months. This passage does not contain 2-word phrases by 24 months of age. People who lose language skills or social skills at any age have a difficult time doing those things. Causes autism spectrum disorder. There is no known cause for autism spectrum disorder. Symptoms and severity vary, which means that there are probably many causes. Both genetics and environment may play a role. Genetics. There are several different genes that appear to be involved in autism spectrum disorder. Some children with autism spectrum disorder may have a genetic disorder such as Rett syndrome or Fragile X syndrome. Other children may have mutations that increase their risk of developing autism spectrum disorder. There is chaos in the brain. Other genes may affect brain development or the way that brain cells communicate. Some genetic mutations happen spontaneously. Environmental factors. Scientists are currently investigating whether factors such as viral infections, medications, or complications during pregnancy or air pollution may contribute to the development of autism spectrum disorder. Risk factors. Autism spectrum disorder. The number of children who are diagnosed with autism spectrum disorder is rising. We don't know for sure if this is due to better detection and reporting or if there really is an increase in the number of cases, or both. Autism spectrum disorder affects children of all races and nationalities, but certain factors increase a child's risk. These may include having a family history of autism or other mental disorders, having unusual symptoms at birth, being born prematurely, or having low birth weight. Your child's sex. Boys are more likely to develop autism spectrum disorder than girls are. Family history. Parents of a child with autism spectrum disorder are more likely to have another child with the disorder. It is not unusual for parents or relatives of a child with autism spectrum disorder to have difficulties interacting socially or communicating effectively. Some behaviors characteristic of the disorder are observed. Other disorders. Certain medical conditions increase a child's risk of developing autism or similar symptoms. Some examples include Fragile X syndrome, an inherited disorder that causes intellectual problems, tuberous sclerosis, a condition in which benign tumors develop in the brain, and Rett syndrome is a genetic condition that occurs almost exclusively in girls and causes slowing of head growth, intellectual disability, and loss of purposeful hand use. Extremely preterm babies. Babies born before 26 weeks of gestation may have a greater risk of having autism spectrum disorder. Parents' ages. There is not yet a clear connection between children born to parents who are older and those who have autism spectrum disorder, but more research needs to be done in order to determine if there is a link. Complications. Autism spectrum disorder. A problem with social interactions, communication, and behavior can lead to problems. Some problems that may occur in school and with learning are not being able to focus on what is being learned, having trouble remembering what was learned, having difficulty making connections between what was learned and how it can be used in real life. Employment problems. Inability to live independently. Social isolation. Stress within the family. Victimization and being bullied. Prevention. Autism spectrum disorder. There is no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention can improve a child's behavior and language development. However, intervention is helpful at any age. Most children do not outgrow autism spectrum disorder. The disordered symptoms that a person may experience will. Diagnosis. Autism spectrum disorder. Your child's doctor will check for signs of developmental delays at regular checkups. If your child shows any symptoms of autism spectrum disorder, you'll likely be referred to a specialist who treats children with autism spectrum disorder, such as a child psychiatrist or psychologist. A neurologist or pediatrician who is knowledgeable about developmental disorders would be a good place to start for an evaluation. Autism spectrum disorder, ASD, is a complex condition with a wide range of symptoms, so it may be difficult to make a diagnosis. There isn't a specific medical test that can determine the disorder. A specialist may watch your child and ask how their social interactions, communication skills, and behavior have changed over time. Give your child tests that cover his hearing, speech, and language development at the developmental level as well as social and behavioral issues. Observe and score your child's social and communication interactions. The criteria in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, are used to diagnose mental disorders. Ask other specialists to help make a diagnosis. It is recommended that genetic testing be performed in order to identify whether your child has a disorder such as Rett syndrome or Fragile X syndrome. Treatment. Autism spectrum disorder. There is no cure for autism spectrum disorder, and there is no one treatment that works for everyone. The goal of treatment is to help your child improve their ability to function by reducing symptoms and supporting their development and learning. Early intervention can make a big difference during the preschool years. Help your child learn important social communication skills. There are many treatments and interventions available to parents of children with autism spectrum disorder, but it can be difficult to decide what is best for your child. Your healthcare provider can help you find options and resources in your area. If your child has autism spectrum disorder, talk to experts about creating a treatment plan and assembling a team of professionals who can meet your child's needs. Treatment options may include behavior and communication therapies. Many programs focus on reducing challenging behaviors and teaching new skills related to social interaction. Some programs focus on reducing problematic behaviors and teaching new skills, while other programs focus on teaching children how to act in social situations or communicate better. Behavior analysis, ABA, can help children learn new skills and use these skills in multiple situations through a reward-based system. Educational therapies. Children with autism spectrum disorder often respond well to highly regimented educational programs. Programs that are successful typically include a team of specialists and a variety of activities designed to improve social skills, communication, and behavior. Preschool children who receive intensive individualized attention often fare better than those who do not. Behavioral interventions often result in good progress. Family therapies, parents and other family members can learn how to play with and interact with their children in ways that help promote social interaction skills, manage problem behaviors, and teach daily living skills and communication. Other therapies, speech, occupational, and physical therapy, may be helpful for children who need them to improve their communication skills, daily living abilities, and movement. A psychologist can provide advice on how to address problem behavior. Medications. There is no cure for autism spectrum disorder, but specific medications can help control symptoms. For example, some medications may be prescribed if your child is hyperactive. Antipsychotic drugs are sometimes used to treat severe behavioral problems, and antidepressants may be prescribed to help improve moods. Tell any healthcare providers that your child is taking medications or supplements. Make sure to keep them updated on all of the medications and supplements your child is taking. Sometimes the combinations of these substances can lead to dangerous side effects. Planning for the future. Most children with autism spectrum disorder continue to learn and compensate for problems throughout their lives, but they will usually require some level of support. Planning for your child's future opportunities, such as employment, college, living situation, and independence, is important. If the leaf is too lightweight, it will not hold its shape while decoupaging. Alternative medicine. Some parents of children with autism spectrum disorder seek alternative or complementary therapies, but there is little or no research to support the effectiveness of these treatments. You may inadvertently reinforce negative behaviors by providing them, and some alternative therapies could potentially harm a child. Be careful. Talk to your child's doctor about the scientific evidence behind any therapy you are considering for your child. Some complementary and alternative therapies may offer some benefits when used in combination with evidence-based treatments, such as creative therapies. Some parents choose to supplement educational and medical intervention with music or art therapy, which focuses on reducing a child's sensitivity to touch. These therapies may offer some benefit when used in combination with other treatments. Sensory-based therapies. These therapies are based on the unproven theory that people with autism spectrum disorder have a sensory processing disorder that causes problems with touch, balance, and hearing. Therapists use brushes, squeezable toys, trampolines, and other materials to help these people tolerate or process sensory information. These therapies may not be effective, but it's possible they could offer some benefit when used in conjunction with other treatments. Massage. There is not enough evidence to determine if massage can improve symptoms of autism spectrum disorder. Pet or horse therapy. Pets can provide companionship and recreation, but more research is needed to determine whether interacting with animals can improve symptoms of autism spectrum disorder. Some complementary and alternative therapies may not be harmful, but there is no evidence that they work. Some may also be expensive and difficult to use. Some examples of these therapies include special diets. There is no evidence that special diets are an effective treatment for autism spectrum disorder. And for growing children, restrictive diets can lead to nutritional deficiencies. If you decide to pursue a restrictive diet, work with a registered dietitian to create a meal plan that meets your specific needs. This passage is about a child. Vitamin supplements and probiotics. There is no scientific evidence that vitamins and other supplements help with symptoms related to autism spectrum disorder, and they can be expensive. Talk to your doctor about the best way to provide vitamins and supplements to your child in a safe and affordable way. Acupuncture. There is not enough research to show that acupuncture is effective for treating autism spectrum disorder symptoms. Some complementary and alternative treatments are not recommended for autism spectrum disorder because there is not enough evidence that they are beneficial. These treatments could be dangerous if used incorrectly. Some examples of such treatments include chelation therapy. This treatment is said to remove heavy metals from the body, but there is no scientific evidence that it is effective for people with autism. There is potential for serious harm if chelation therapy is used in children with autism. The therapy has stopped working. Hyperbaric oxygen treatments. Hyperbaric oxygen is not an effective treatment for autism spectrum disorder symptoms, and it is not approved by the FDA for this use. IVIG infusions are treatments that use injections of antibodies. There is no evidence that using IVIG infusions improves autism spectrum disorder, and the FDA has not approved immunoglobulin products for this use. Coping and support. Raising a child with autism spectrum disorder can be tiring and challenging. These suggestions may help. Find a team of trusted professionals. A team coordinated by your doctor may include social workers, teachers, therapists, and a case manager or service coordinator. These professionals can help identify and evaluate the resources in your area and explain financial services and state and federal programs that are available to children and adults with special needs. Disabilities can occur. Make a record of each visit to a service provider. Your child may have visits from many people involved in his or her care. Keep a file of these meetings and reports to help you decide about treatment options and track the progress of your child. Learn about the disorder. There are many myths and misconceptions about autism. By learning the truth, you will be better able to understand your child's attempts to communicate. Take time for yourself and your family. Caring for a child with autism spectrum disorder can be stressful. To prevent burnout, try taking time out to relax, exercise, or enjoy your favorite activities. Spend time alone with your other children and plan special dates with your spouse. Spend time with, even if it's just watching a movie together after the children go to bed. Look for other families who have a child with autism spectrum disorder. Parents and siblings of children with autism spectrum disorder may find helpful advice in other families that are struggling with the challenges of the disorder. Some communities have support groups for parents and siblings. Talk to your doctor about new technologies and therapies that are available to you. There are many ways to help children with autism spectrum disorder. See the Centers for Disease Control and Prevention website for helpful materials and links to resources. Preparing for your appointment. Your child's healthcare provider will check for developmental problems at regular checkups. If you have any concerns during your appointment, mention them. If your child shows any signs of autism spectrum disorder, you'll likely be referred to a specialist who can treat your child for the disorder. An evaluation is a process of judging something. If possible, bring a family member or friend to the appointment so that they can remember the information and be supportive. Here is some information that will help you prepare for your appointment.